Today I want to talk to you about panic attacks. Panic attacks can be really scary, overwhelming. We don't know what's going on or why they're there or how to control them. And a lot of people can get really frustrated with themselves when they experience panic attacks. It can be something that happens constantly, where it'll happen as a regular thing in your life that you've had to get used to. And for a lot of people, they don't feel comfortable going out in social settings or to work or other places where they're worried that they're going to have an attack, and so they want to stay close to home. That's called agoraphobia. And so panic attacks can be a serious thing that can cause a lot of disruption in your life. And so I want to talk to you about what it is and some different things you can do to help for your next panic attack. So first of all, a panic attack is this heightened state of anxiety where it can feel like a heart attack, where we can have heart palpitations. Our heart can be beating really fast. We feel a lot of tightness in our chest. We can feel like a headache and like we can't think, we can't do anything else. And a lot of people, when they have a panic attack, all they need to do, or all they can do, is to go and lay down on a bed and to wait for the pain to go away. It's really tough. And the reason we have panic attacks is it's this dysregulated anxiety that becomes really physiological. So whenever we get anxious, sometimes our bodies give out smaller signals at first. Let's say we feel a little fluttering in our chest, or we feel some kind of tension or anxiety around a certain situation. And then it can build without our knowing it until it gets to a point where it feels like something is physiologically wrong. And at that point, it's kind of like a gear that isn't hooked up, like if you have the clutch in and you rev the car, where the engine just goes all the way in red lines, right? It's this redlining of your physiological symptoms, your physiological system. And so something that can be really tough is that it's hard to break. A lot of people will go into an ER because they think they're having a heart attack. And what I want you to know is that there's a lot you can do and learn from with a panic attack. Something that's really important to know is that when you have a panic attack, it's a sign that something is off in your life. Something is hard to deal with. Something is putting pressure on you. You're re-experiencing some really big stressor in your life. And sometimes we don't know on the surface what that is, and that can be frustrating and difficult. So there's a long-term solution of how to reduce panic attacks, how to reduce how frequently they happen and how extreme they are. But the first solution that we want to have is for what to do when you experience an attack. The first thing that I want you to do is to have a little journaling time for yourself, and you're going to ask yourself a couple questions. When did these panic attacks start? How bad are they? What's the normal course of a panic attack? For example, if you have a normal panic attack, what does that look like? When does the pain start? How bad does it get? What symptoms do you experience? And when does it go away? Right? How long does it last? Does it last for 15 minutes, 30 minutes, an hour? Usually panic attacks last under an hour, around 30 minutes, right? But we want to start to chart that out so we can kind of take a break and think, okay, let's journal out what a normal panic attack looks like and when they started, right? When in your life have you always experienced panic attacks, or was there a moment at which they started or became worse? Okay, so we want to chart those things out. And the reason that's important is that when you go into a panic attack, you want to have a general idea about what the course of the panic attack is, how long you're going to have to sit on the bed or be in a safe space. The next thing you want to do is you want to make a plan for the panic attack. A lot of people get frustrated when they have a panic attack because they just want it to go away. But something important to know is that once you get to that heightened state, there's really nothing you can do besides wait it out. So a lot of it is releasing, relaxing, and just letting it happen, as difficult as that is. So you want to find a comfortable place where you're maybe not around other people if that's stressful for you, and just be somewhere where you can maybe hold something like a pillow. You can just make yourself comfortable, lay down, drink some water if you can. Just let yourself ride it out as if you have the flu and you're throwing up, where you just say, this is just what it's going to be for a bit. And however long those normally take, you just kind of want to set that on a timer. Just say, I'm just going to be out for 30 minutes. Right? So there's nothing that you can do. You don't want to talk about your anxiety. You don't have to talk about it or figure it out or make it go away. You just have to ride the wave. And at the end of the 30 minutes, or however long the panic attack takes, that's when you can do some assessing. And what you can assess, and again, I would get out that same journal or piece of paper or note app that you have, and I would ask yourself a couple questions. First of all, you can ask, when did I first start experiencing the panic attack? When did it first start to come on for me? And what was the earliest that I could tell that I was starting to get anxious? Some people, their anxiety is building maybe over a week before they have an attack. Some people, it's over a day. When was the first moment at which you remember being anxious or tense, right? And sometimes you can kind of, listen and think, okay, maybe it was earlier this morning when I woke up and I heard this news, or I realized that something didn't go through or something fell apart. Whatever that is for you, see if you can do a little bit of exploring after the panic attack is over with the earliest moment that you remember yourself feeling anxious. Okay, so that's what you can do. You can kind of journal those out. Everything apart from that is going to be some work that you can do with a professional to understand what is going on for you and learn ways of regulating and managing your anxiety before it gets to an attack, right? And so we want to learn, the skill in the therapy sessions is learning how do we pay attention in better ways to your anxiety, so that before you get to the panic attack, you can listen to yourself, you can take care of yourself, and you can help yourself resolve the anxiety before it gets into an attack. So again, that's a little brief introduction about panic attacks, what they are, and what you can do right now, today, for an attack that's happening or has just happened. So I wish you the best there. We have therapists who can help you with panic attacks. We have assessments where we can figure out what's going on for you, what is the level of anxiety or depression that you might be holding that's leading to an attack. So we can do a psychological assessment. We can also do therapy, intensive and long-term therapy, to help you learn new ways of managing anxiety so that it doesn't get to an attack. All right, thanks so much.